So we're going to move kind of quickly. I'll try to be as efficient as I can. I started holistic dentistry following that path back in the early 90s. These were the two books that launched my interest into holistic dentistry. And living in Dallas, my wife and I used to go to our holistic dentist in Carmel Valley in California. So that's how much we respected and knew that dentistry is such a key to health. The beautiful thing I love about examining any part of the anatomy with thermography and thermometry, as they call it, is that it gives you the whole picture instantly, gives you the complete view of that anatomical area of the body. And it shows things anywhere from 7 to 10 years before they manifest on the physical level. So you're getting true functional medicine. It's a very professionally done thing. Oops. I had to include these quotes because I think they're so important from the work that Dr. Cass has presented in the past, and it talks about a classical focus within an organism is a segment of infected tissue from which disease-causing bacteria, viruses, and their toxins spread, blah, blah, blah. And then we go that they talk about could be, his examples are a chronic tonsil, a dental abscess, and he just references perfectly that most focuses do start in the teeth. This I thought was a beautiful quote that I wanted to share because it's again from the functional medicine book that Dr. Cass references, and it talks about the relationship between the mesenchyme, the lymphatic, and the autonomic nervous system. And it's just a beautiful thing to show how those infections get stuck and wind up really in that mesenchyme area, and that's what we're all working with all the time. This is a picture of an ideal thermogram. There are 2 readings that are taken, and this has been done to establish when you get any thermogram report back. This is the background of the thermogram to let you know what the ideal thermogram actually looks like. I wanted to give you a close-up of the head because we're going to look basically as fast as we can at head, neck, and teeth. So each area has their own ideal thermogram that you can look at and become familiar with very simply. The teeth also have a natural sine wave of an ideal thermogram. Just to get oriented, when you do a thermographic evaluation, you have 2 readings, and the first reading is done as you enter into a room that's temperature controlled. You do all the readings, you sit there for 10 minutes, you do the second readings. Typically, after the cool stress, you have a warming in most parts of the body. In the head and the teeth, you have a warming. But there are other possible regulation interferences that can take place, which we don't need to go into. So these are all the points that are done in the head, and I just wanted to show that the head is then reflected in the report. So if we look at this little area right in here, that would be the normal area. That's the background for normal, and these are all the points that are abnormal. And this graph comes from the testing of these points. Same thing is done with the neck, with all the lymphatic points, with tonsillar points, with thyroid points, and then you have your background again, and that's how this scan actually takes place from the points. Same thing with the teeth. Every single tooth is checked. Then on the report you have a 2D rendering, so you can actually, again, get a very clear picture of what's going on. You can see areas of inflammation. You can see areas that are degenerating. You can see areas that are normal, and you can see areas that are so congested and blocked that they're probably holding a lot of toxicity, which here is also reflective a lot in the teeth. From that picture is developed again from the graphs. I'm just trying to show you the sequence of all the different ways, the sequences of how the report is followed. And it ultimately just paints a nice picture so you can look at an area of the body, look at the thermogram, get as detailed as you want, or you can get a general overview of what's happening in that area of the body to help you paint your picture. On the teeth profile, again, these yellow teeth are all foci. They're all potential areas of either dental infection or something going on in the jaw area. Then you have the reflection of every single tooth that has a certain legend which lets you know the degree of severity in the tooth area. So the picture is a reflection exactly of each person's thermogram. This is actually a real thermogram that we're working off of. This was this person's organ teeth associations. You can show and see all of these organs and all of the meridian connections with all of the organs it can possibly influence, and each tooth is clearly defined so you can further do your testing and see where your dentist colleague needs to work and what kind of organ to tooth relationship there is. Usually if there's multiple organs, multiple teeth that are showing up at the same organ, it's pretty indicative that it's the organ. It's not coming from the teeth. Right. Okay, so then we have over the history of thermography that each area of the body has signature recognition patterns that are then put into a bar graph. So you can actually, again, get a very particular view here of the head and cranial disturbances. So in this particular person, their first one that's shown here is the severe brain toxicity, which is going to be a combination of pesticides, herbicides, fungicides, solvents, and heavy metals all put into one. You can also see it's going to check for carotid and cerebrovascular abnormalities or cranial dysfunction, along with TMJ problems. Also, the sinuses are clearly defined. Same is done for the neck, where you have the amount of lymphatics that are blocked and not flowing freely. You have the potential for seeing if there's a significant focal infection in the tonsils, and obviously thyroid is getting evaluated. And this is a very, very beautiful quality of giving you a clue if the emphasis is in the head or if it's in the body. Oddly enough, most of the time, the thermograms show that it's the head. Yeah. So it's totally in line with Vol and everything philosophically that we've learned and clinically that we've learned. Again, the signature recognition for the teeth area, so it gets very simple. This is also an amazing tool which I feel has been very helpful clinically with patient compliance, because when they have a picture or they have something written that's simple to understand, then the compliance for both supplementation, diet, or therapies is very, very high. So here we're showing foci suspicion. We could have toxicity, TMJ, or gingivitis, periodontitis. It's going to give you direct feedback on all those. The arrows show which area of the teeth are warmer, which is usually going to reflect in a revealing of a TMJ problem very clearly. The teeth are actually defined very specifically because you can see that one tooth that's a speckled gray tooth is going to be a highest priority. Dotted teeth, which will show other kinds of infectious agent processes, but not as crucial or as dynamically needing care. The third is going to show all the toxic teeth, and the bottom is what we mentioned earlier, which could be TMJ, neck, it could be occiput, or it could be even cranial bone imbalance. I wanted to share this just because when I prepare for a lecture like this, it kind of innervates everything that I have forgotten. It just enlivens everything. And I went back and I started looking at this is just head lymph. And when you look at every single thing that you can't read there on the far right is still lymphatics that aren't even described necessarily in the big picture. So the amount of lymphatics that are involved in the head is just amazing, and that's why biotoxicosis is so critical in everything that we do because it always works with lymph. This is just a little recap that shows this is the front page of the report. We're specifically looking at the head, neck, and dental, and you get a little description here. In the head, each area of the body is talked about in relationship to disorder. If disorder increases, that's bad. If disorder decreases, that's always good in our lives and in anything we look at. So here it shows there is a severe evidence for brain toxicity. So basically this is a recapitulation of everything that we just went through, but it's put in one simple place so you can see it and easily access it. There's a minimal cardiovascular carotid circulatory deficiency, and on and on and on. I'm trying to be brief.
You do great.
If we then isolate just those three that we're talking about, you can see how you get a very clear picture when you're evaluating dental of the influences that are occurring in the head and the neck to paint a very clear picture as to the potential ways that you need to focus and proceed. I like this because this really completes the whole dental picture. The thermogram has the ability to not only evaluate the things that we kind of went through, but you're going to look at the external carotid is reflected in the thermogram, the internal carotid, so you can get an idea if the cerebral vasculature is compromised. You're going to have a very quick glance to see if you have cranial imbalances or TMJ neck imbalances. All three sinuses are very clearly depicted to see the amount of toxicity that's deposited, especially when you're looking at teeth and the reflection in the maxillary sinus. Those relationships are very intimate, so it gives you another idea of if that upper tooth area is being influenced by a huge amount of dumping of toxins into the sinus cavities. In the neck evaluation, you're looking at thoracic duct, you're looking at the right lymphatic duct, you're looking at inframandibular lymph nodes, and the anterior lymph nodes, and then the tonsils. So everything here is why I love thermography, because like I said, any area that you look at, it's a multifaceted, very clear approach to a quick overview in depth of what's possibly brewing down the road or what's happening right now. This is a little before and after I wanted to share. It's kind of self-explanatory, but basically the before showed x-rays of the cavitation, and it showed in that lower left quadrant, tooth number 17, where that tooth was completely blocked. And after the cavitation was properly taken care of, then that tooth, which is in the lower after, completely restored to normal regulation. This is, again, the relationship of organ to breast. Here you're looking at some basic microcalcifications, but you have breast pain and you have a possible mass. This is an actual patient case history. So you have the 2D picture, which is going to show you the paradox regulation, which means things are heating up in this area. You have these darker circles, which shows that the lymphatics in that area are not flowing properly. And you have the arrow, which is showing that this right breast, where she was concerned, and where there was a palpable mass, is the warmer side. So where you have heat, you have an increase in metabolic activity. Down below, you have normally 12 criteria. 8 out of the 12, 0 to 5 is normal. Her criteria was a number 8, so that's pretty significant. And one of the things that's circled here is the second molar. So when you look at the breast analysis, you can see that the distant focal related is severe, and that then leads us to looking at the other things outside of the breast that can be causing this feedback. So we also have the heavy metal indication. and the organ tissue influence. So all three are severe. So when we pinpoint things, this is the actual thermogram itself. We have a speckled tooth, which is highlighted as being critical and needing to, sort of like a red flag when you have that, that needs immediate assistance in some level. We have tooth number 4 adjacent to it, also showing and reflecting the right breast. So it gives you a total correlation as to what's happening between dental and the organ, and gives you a greater degree of knowing what's happening there. This is what we mentioned earlier, that there are signatures in the body that allow you to differentiate between the emphasis being in the head or the torso, and it's really extremely helpful to know that, yeah, that is the highest priority between those two areas of the body.
Yeah.
And there's our happy.
Very well done.
All
Thank
right.
you. Good.
Thank you. Yes, sir. Here I am.
You're back to Sean. There you go.